Okay, let's get comfortable because I want to talk to you about my upper and lower blepharoplasty surgery that I am having tomorrow. If we haven't met before, my name is Megan. I am 50 years old. I've been doing this Fit at 50 journey all year, so you might know me from my blog, Honey We're Home, or my YouTube channel where I've been chronicling that journey. And so today's video is a little bit different. I wanted to kind of go into detail about the eyelid surgery that I'm having in case you're considering it for yourself or are just interested in the details. So I'm sitting here today. My surgery is tomorrow. I found a surgeon here in my area. I'm in Houston that was recommended to me by my optometrist. So the surgeon that I chose specifically focuses only on eyes, and I went and had a consult with her. I feel very comfortable. We're going to do the upper and lower blepharoplasty at the same time. It's under twilight anesthesia where you are considered awake in case you need to respond to any commands like to open your eyes or blink or what have you, but it's not supposed to hurt. You're not supposed to be able to like feel anything or maybe even remember. So I'm really excited. I'm very nervous. And it's just something that I've wanted to do for a really long time. So the procedure is supposed to remove like excess skin and fat so that it gives your eyelids a more youthful appearance. In the upper, she'll be making an incision at the crease and then stitching it back up. There will be a scar that should heal over time. And then in the lower, she makes an incision inside the eyelid with very fine sutures that dissolve over time. So there is some pre-op things that I've been doing, and I've got my pre-op instructions right here. So basically, I go tomorrow and I just wear something loose, no makeup, clean hair, and bring large dark sunglasses to wear home. I am taking arnica tablets right now to help with like bruising and swelling. I also started an antibiotic today, and then there is ointment that she's prescribed for me to put inside my eyelids as I recover, as well as get these eye drops because you can have like dry eyes after the surgery. So as far as swelling and bruising, it says in most cases it resolves within 1 to 3 weeks. You can use cold compresses as much as possible for the first 48 hours. So I bought one of those chillable eye masks from Amazon, so I have that ready to go. For the first several days, you are supposed to sleep with your head elevated and on your back. Avoid sleeping on your side for 7 to 10 days, which is going to be a challenge because I am a side sleeper. And then as far as exercise, this one's going to be really hard for me because I currently work out literally every single day. I do weight training, I do Stairmaster, I do 10,000 steps a day, and I am supposed to avoid exercising strenuous exertion, bending at the waist, or lifting anything heavier than 10 pounds for 2 weeks. My post-op visit will be in 1 week when she will remove the upper stitches, and then I think she can let me know like what activity I'm able to do, but I will follow the instructions because I want to heal, and I know that that is so important. So I'm just going to be taking it easy and doing some light walks while I recover. You can apply the ointment to your incisions, and it says that pain and discomfort are typically minimal after surgery, and usually regular or extra strength Tylenol is sufficient to treat it. There can be some bleeding and makeup. You can resume wearing makeup 2 to 3 days after stitches are removed, but be gentle removing your makeup. Right after surgery, when you go to bathe from the neck down. Use the eye lubrication. Don't wear contact lenses for 3 weeks. I am a contact lens wearer, so that will be another challenge. And as far as pre-op, I think that is basically it. As far as like the important things, I think we hit the high points. So what I plan to do on this vlog is just give you daily updates so you can see the healing process from the day of surgery all the way for like maybe 2 weeks. We'll see. But I'm excited to share the process with you. Fingers crossed for really good results. And I hope this video is helpful for you if you are considering this procedure. Hello, it's day 2. I am very swollen and red and bruised. I'm hoping that this is the worst that it is. It does not hurt at all. It's not painful, but it's just very, very swollen. My eyes are kind of tight and sore and just uncomfortable. I've been icing with the P's every 30 minutes, so I do 30 minutes icing and then 30 minutes off. Eating fine. I have energy and I want to do things, but I can't see very well. I am putting the ointment in my eyes 3 times a day still, and also drops because my eyes are tending to get a little bit dry. So I look way worse than I feel, but I know this is just part of the healing process. So I'm hoping that I start to look better, day by day. And I just wanted to show you day 2 progress. Hello, we are day 3 post upper lower blepharoplasty and very uncomfortable. The ointment I have to put in my eyes makes my eyes really blurry and then I cannot see, and that is just so strange and frustrating. My eyes also feel like scratchy, probably from the sutures that are on the lower eyelid. But again, not painful, it's just sore and irritated and tight. But I think that this is, the way the healing is supposed to go. I think it's healing and progressing the way it should. It's my understanding that at the 48-hour mark, which was this morning, that the swelling can be at its peak, and now we're, moving into day 4 tomorrow, so it's about 6 p.m. right now as I'm recording this. So yeah, here's how I look. It is not pretty, but one day at a time. Still icing, 30 minutes on, 30 minutes off. Good morning. It's the morning of day 4 of my eyelid surgery. I woke up after sleeping really pretty well. It's still kind of difficult because I have to sleep sort of upright, but I've been using one of those airplane neck pillows and then propping the pillows up behind me and beside me so I can kind of, sleep as comfortably as I can. But I woke up and my eyes are just so blurry, so caked. But I tried to just clean them out gently with a Q-tip, and then iced a little bit this morning, like 20 minutes. I don't think I'm supposed to continue icing or really need to because the swelling has gone down significantly. But I did want to report that I felt more energy today, and so I actually went on a little walk. I'm not supposed to get really sweaty or anything because I'm not supposed to get water in my eyes. It's just because of the chance of bacteria. So if you do need to wash your face or get water near your eyes, distilled water is what's preferred. But I went on about a 20-minute walk outside and then just a gentle, I think 20 more minutes on my treadmill. So actually that felt nice. So I've been washing my face just with a cloth so that I don't get water everywhere, and taking below the neck showers. So that is what I'm about to do now, and just hoping that every day continues to get a little bit better. Hello, it's day 5 of my recovery, and I feel like things are healing nicely. All the tape has come off on its own. The most frustrating part was yesterday specifically. My eyes were so blurry all day and I just could not see clearly, and it was So frustrating. Also yesterday I was done with icing, so I think that when you're icing, you know, laying back with your eyes closed with peas over your eyes for 30 minutes on, 30 minutes off, you have less opportunity to try to see throughout the day. But yesterday I had no icing, and so I tried to do a little work in the morning. I got a little bit done, but it's just so hard. So I just tried to relax most of the day yesterday. Today I woke up and I just feel like there's so much gunk in my eyes and almost like they're kind of glued shut. So it kind of just got them cleared out a little bit. I was able to go for a really nice walk. I just wore sunglasses and a big hat to protect my eyes, and it was overcast and, you know, nice temperature out. So I did like an hour walk and that felt great. And I just got home and took a shower. So I think I feel very fortunate that I don't have much bruising. So that's really nice. The upper lids are still really puffy and red. The sutures underneath feel really kind of like scabby and sharp. So I did just put ointment on. Right now I'm supposed to apply it 3 times a day. So the ointment is erythromycin. So it has an antibiotic in it. And then I also wanted to show you the other things I had been taking. So I literally just finished this pack of antibiotics, and I had to start taking that the day before surgery all the way through yesterday. There was another antibiotic that I finished yesterday, and then I started taking this vitamin C and quercetin. It's supposed to help with inflammation and your body's healing process. So these are pretty big pills. So I split them in half, and I was taking, so 2 pills a day in 4 different doses. I don't know if that has helped, but I took that. And then arnica tablets, and these, the dose on these is 2 tablets 3 times a day. And I started that like the Monday before my Friday surgery. However, you're supposed to let the 2 pills dissolve under your tongue. And at first, like the first few days, I missed that. And so I was swallowing them, but you're supposed to put them under your tongue, 2 pills 3 times a day, and also nothing to eat or drink 15 minutes before and 15 minutes after to let them really absorb and do their thing. So I'm continuing to take these, but since I don't have that much bruising, I think today will be the last day I will take those. And then I also did use the arnica gel, like here, but this kind of, it's a clear gel, but it sort of dries kind of like hard, not hard, but like it kind of felt like it was pulling a little bit. So I don't think I need this anymore, but I just wanted to show you like all the things. And then I have been using these Refresh eye drops, and they come in a little individual like serving size. So you just twist off the top and put them in your eyes. These kind of help because your eyes feel kind of dry. So this kind of helps give them some moisture. So I've just been using these like whenever. They're lubricant eye drops. So that's the update for today. I do feel like we're healing a little bit better day by day. Here's kind of a close-up. It's Tuesday. What day is it? I think it's Tuesday. And on Friday, I go and get the upper sutures removed. The lower ones are supposed to dissolve on their own. So I will be back tomorrow, and we will check in for the next day. We are day, gosh, what day is it? Friday, Saturday, Sunday, Monday, Tuesday, Wednesday. Day 6 of recovery. And I think today is the day I feel actually the best. All the tape is gone. I'm done with my prescription medication. I don't have any under eye bruising, which I'm really happy about. My eyes still get blurry because I have to put the ointment in. And Friday I go to get the sutures removed. So let me get closer so you can see what we're looking like. It's still tight and heavy and swollen up here, but I think we are progressing nicely. Hello, it is day 8 and it's the day I get my sutures out. So I had my surgery on a Friday and it is the following Friday, and I go in about 1 hour to get the upper sutures removed, and I feel like my upper lids are still so swollen. Shh, my dog. And I feel like my upper lids are so swollen still, and I'm hoping that once the sutures get removed that swelling will go down. I'm really pleased with how I don't really have much bruising underneath, and the under eye seem to be healing really well. I do still have some scabbing underneath along where the dissolvable stitches are. So I'm about to take 2 Tylenol. I'm a little nervous that it's going to be painful just because it is sort of sore. But otherwise, I'm just kind of over it by now. I'm over like the tightness, the itchiness, and the blurriness from putting the ointment in. So I have some questions I'm gonna ask the doctor, and then when I get back, I will give you like the questions and answers and let you know where we are at. And I just feel like I'm really ready to heal because I cannot keep hiding out in my home. It's been a week and I'm hoping to get back to work next week. Hello, we are day 9. So had my surgery on a Friday and it's the following Saturday. I got my stitches out yesterday. Here is what my eyes are looking like close up. Here's how they look without the stitches. I was so nervous about the stitch removal. I thought it was going to be very painful, and it was not painful at all, and it only took a second. She even had to remove like a teensy bit of scabbing, and that didn't hurt at all. She was very gentle, very delicate, and it was over in a snap. So wasn't painful. I did take 2 Tylenol about an hour before, but like I said, it didn't hurt. So my post-op instructions are, well, before I get to that, let me just say, I was mostly concerned because my upper lids are still so swollen, even more so yesterday, and she assured me that that is normal, that they look, you know, like they're healing nicely, and that now that the stitches are out, the swelling should go down. If it's not down significantly by Monday, she said she would call me in a steroid, but she didn't want to start me on that just yet. So we will see. I have 2 more days, and then we'll see how they look on Monday. And if they're still swollen, I'll call her office and let her know. I do think the swelling has gone down a little, and I can tell that like now I'm starting to have a little bit of that yellow bruising on the under eye, which I think is normal as the swelling comes down. So I'm to continue applying the ointment just because I still have like some healing along the lower incision and where the stitches were. So continue the ointment for 3 more days. And then after that, if I need to, she said I could use Vaseline. I'm cleared to work out starting Monday, like intense workouts, which I'm so surprised about. I guess I just need to see if I feel up for it and how I look, because at this point, you know, I can't even open my eyes all the way, and I'm still very self-conscious about how I look, so I don't know, we'll see. I cannot swim for 2 more weeks. I can apply makeup in 3 days, and skincare is fine to do now, just being careful to avoid the eye area. And then I can actually wash my eye area in 3 more days, just being, again, very gentle. She said in 3 to 4 weeks, I can start applying vitamin E to the scar where the incision was in the upper lids. But what she really wants me to focus on is these blinking exercises where you close your eyes slowly, keep them closed for 10 seconds, and then open slowly. And she said, do that all day long. It just helps retrain your eyes to blink, because after surgery, I couldn't close them all the way. And so this is kind of just teaching your eyes to get used to blinking again. So I think so far we're doing well. It's been a slow process. I feel like I thought I would be further along by now, especially with like the upper lids, and my eyes still get so irritated with that ointment and blurs my vision. But I mean, I think it could be worse. So that's the update so far. I will check in with you soon. Okay, I came outside to film because it's getting so dark inside. It's about to rain, or it's actually just started raining, but we are on day 13 and things are finally improving a little bit. On Monday, I started a second pack of steroids, which is this, and you take several each day. But my upper lids were still so swollen, and so I felt like I needed something to help reduce the swelling. So this has actually helped a lot. I have been cleared to wear makeup, so I have a little makeup on. I don't really have eye makeup on except for mascara. But here is how everything is looking. So I just wanted to check in. Tomorrow will be 2 weeks. I feel like this recovery is taking longer than I thought it would, longer than what I've seen in other videos of people that are recovering from this surgery. But I had my upper and lower eyes done at the same time, so maybe that's why. But I finally feel like I can see the light at the end of the tunnel, and I finally, really it took till day, like yesterday, till I started to feel like I'm gonna like how it looks when it's all healed. I was starting to get worried there for a bit, but here is the progress. Let me come closer so you can see. And I will share in a few more days as things, you know, get better and better. And then, I mean, I'm guessing it'll be like a full month until it's really well healed and on the way. But okay, check back in with you soon. So we are finally 1 month post-op. It's just been a little over a month, like a month and a few days. And I had a post-op appointment with my doctor at exactly 1 month, and again, she said things are healing very nicely and she's excited about the progress. So let me give you a close-up view of how we are looking 1 month out. And you can still see I have some scarring here. So what she said to do now for 1 week is to massage, but I don't think it's like massage. It's basically like she wants me to take my thumbs and like press into the scar, like looking down, and just kind of give it a good kind of like rub for a few seconds all the way over the whole scar region. And what she said is that that helps break up the scar tissue, which will also make your eyes feel a little less tight. My eyes do still feel kind of tight, kind of dry, like just not right, like just not 100%, if that makes sense. So she said that that will help with that. And also I'm supposed to use these tears 4 to 6 times a day, and that helps keep your eye lubricated and helps it also heal. And then something like this I use at night before bed, which is also an eye drop, but this is more of a gel. And so it's a little bit like more lubricating, but it will blur your vision because it is a gel. So you have to use this one like literally right before you're about to go to sleep, not when you want to like look at your phone anymore for the night or anything like that. But another thing we're doing is, so we're right now at the end of August. So in 2 more months, I'll be 3 months post-op, and I go back to my eye doctor, and she's going to start laser treatment. And I think she does a series of 3, and I can't remember how far apart, but she starts a laser treatment to reduce the appearance of the scar. So she said what she does is just puts a little numbing gel and then does a little laser treatment. It takes like 5 minutes, and it should help reduce the appearance of the scar. So I will say, like, all in all, it's been a longer journey than I was prepared for, than I thought it would be based on any other videos or anything I've seen. I feel like any videos I've seen in the past of somebody that's just had an upper blepharoplasty, they healed like that. Like within a week, it seemed like they were pretty much normal. Of course, I did upper and lower, and I just feel like it's been a longer healing process, but I am happy with the results. I feel like my eyes look more awake, like younger, brighter, just, you know, they look better, but they still have some healing to do. So I am kind of like settled in that this is going to be a few more months before I feel like my eyes are quite back to like normal. Just because, like I said, they're kind of tight, they get dry, they're a little irritated, and obviously you can still see the scar. So I'm gonna wrap this vlog up here because I think this gives you a good overview of the whole, you know, 1 month procedure from start to now. And I hope this has helped you if you are considering this procedure or somebody you know or love is. So hopefully this helped, and yeah, have a great day.